it's my pleasure and honor to attend this meeting and share medical and surgical informations with you. My paper is the reduction of the inferior turbinate hypertrophy by diode lasers, 810 nanometers with electrocoagulation. It's a comparative study. As we know, the inferior turbinates are elongated, almost tubular structures inside the nose, and they are tended to humidify air and heating and filtrations of the air breathed through the nose. The size of the turbinate is about the adult index fingers and positions against the side of the side and runs parallel to the nasal septum. Although they are not necessarily the same size, but there are actually 3 pair sets in the turbinate of the nose. The inferior turbinate, it is typically more involved in the nasal breathing. The inferior turbinate is about 50 to 60 millim in length and about 7.5 millim in height and 3.8 in width. The inferior turbinate hypertrophy simply means that the turbinate has an increase in size, in which because it becomes inflamed and the blood vessels inside the membrane swallow and expanding, causing the turbinate becomes enlarged and obstructing the airflow of the nose. There are many causes, but the most important are the chronic nasal allergies and vasomotor rhinitis, deviations of nasal septum, and rhinitis medicamentosa, drug-induced rhinitis. As we can see on the right side, that the normal persons with a normal turbinate that permits the air to pass through the nostrils, while on the left side there is turbinate hypertrophy that obstructs the airflow. There are several medical treatment for the nasal obstructions, including topical medications, nasal steroids, antihistamine sprays, and oral antihistamines. And there are different surgical treatments for the turbinate hypertrophy, including surgical trimming of the mucosa, auto-fracturing of the inferior turbinate, cryosurgery, linear cautery, and the SMD, laser surgery, radiofrequency, steroid, and finally the ultrasound. The laser, it is light amplified by stimulation of emissions of radiation. The laser, it is a concentrated narrow beam of monochromic coherent light with a high energy traveling through particular directions and operating in the infrared and the visible or the ultraviolet regions of the electromagnetic spectrum. Each laser device will consist of 3 components: the active media, which could be solid or gas, such as the CO2 or semiconductors, such as the diode laser, and the liquid. And there is an excitation mechanism. It could be either optical excitations or electrical or chemical. An optical resonator consists of 2 reflecting mirrors. One, it is 100% reflecting, and the other is about above 99%, that permits the laser beams to exist. The effect of the laser beam on the tissue, what we call the laser tissue interaction. This depending on 2 parameters. It is the power density, watt per centimeter square, and the exposure time. So that we can have either a photochemical interactions, such as photodynamic therapy or biostimulations, or we have thermal interactions, which could be hyperthermia or coagulations, carbonizations, vaporizations, and melting effect, and photoablations, and photo-induced ablations, and photodisruption. The aim of this study, it is to evaluate the effectiveness and the complications of the diode lasers 810 nanometer and the reduction of the hypertrophied inferior turbinate in comparison with the reductions by the submucosal diathermia using electrocoagulation. In this study, 14 patients, 10 male and 4 females, attended to the outpatients clinic in Al Yarmouk Teaching Hospital between September 2013 and November 2013. Complaining from permanent nasal obstructions. Their age was between 18 to 40 years, and all of them are not responding to the medical treatment. We have excluding criteria, including severe septal deviation, active rhinosinusitis, previous nasal surgery, bony hypertrophy of the inferior turbinate, and nasal polyp. This is the laser system which has been used, although it's old-fashioned, but it really works good, with a wavelength of 810 nanometers, and the power output is 0.5 to 15 watt, and the treatment mode could be continuous or interrupted pulse mode. It consists of an emitting beam is visible diode laser of 635 nanometer to 660. It is considered as class 4 laser system, and the emitting beam is class 3A. For the safety during the work, we avoid exposing the eye and the skin to direct or diffuse laser beam using eyeglasses with an optical density of 5. The procedure, the applicator uses this piston-like stainless steel through which the thread or the optical fiber has bound with an outer core diameter of 400 micron and inner core diameter of 300 micron. The power used is between 9 to 11 watt, depending on the bulkness of the inferior turbinate. 3 linear winding coagulations are carried out along the inferior turbinate under the local anesthesia. We're using a contact technique and continuous mode. 3 lines are done on the middle surface of the inferior turbinate. While the second group, which 10 patients, were done under general anesthesia with the slight insertions of the fiber tip into the mucosa. This will cause coagulations of the tissue passing through the fiber tip through the whole length of the inferior turbinate. Then withdrawn within 6 seconds. This is done on one side. The other side is the same procedure, but instead of using the laser, we're using the monopolar cautery, sending with a range for 45 to 55 watt. This without telling the patient which side is done by the laser, which side is done by the electrical cautery. For the follow-up, examinations of the patient the first day and after third day, and each week up to 8 weeks. Following parameters, looking for the pain, bleeding, intraoperative or postoperative, crustation, adhesions, and the size of the shrinkage, feeling of the patency, and atrophic rhinitis. Our procedures is just like on the left side, the turbinate hypertrophy. We done the interstitial with the SMD or by using the laser and looking for the results. After 24 hours, the pack is removed and the comparison is done between both sides. Post-operatively, the patients were given systemic antibiotics and simple analgesia. No local or systemic decongestant are given, and patients were instructed not to use local decongestant or steroid drops. The length of the inferior turbinate is about 6.2 cm as an average, and the time taken to pass the probe along the turbinate is about 6 seconds as an average. The speed of using the laser fiber is about 6.2 cm per 6 seconds, which is equal to 1.03 cm per second. Evaluation criteria. The evaluation criteria used in this study including a subjective and objective test, and following up the patients for a period of 2 months follow-up for any complications, whether immediately as bleeding or delay as adhesions and atrophic rhinitis. The results and conclusion. Actually, we divided groups into 4 groups, 2 major groups. It is the group called Group 1 and the Group 2. The Group 1, which is done under local anesthesia. Group 2 is done under general anesthesia. And each one side is done by the laser, which is called Group A, and the second is done by the electrocautery, which is Group B. And after comparing our results, we found that the Group 1A, there is no pain, no bleeding, there is mild edema, no crustation, no adhesions, and no atrophic rhinitis. While Group 1B, there is a mild pain, there is mild bleeding, and obvious edema, moderate crustaceans. Only 1 case shows cyanic or adhesion, and there is no atrophic rhinitis. The second group, Group A, where there is no pain, mild bleeding, and mild edema, no crustaceans, no adhesions. The Group 2B, there is pain, there is moderate bleeding, and there is moderate edema, and there is crustaceans. Conclusion. Diode laser 810 nanometers photocoagulations for the inferior turbinate. It's simple, safe method, and infectious procedures with a minimal invasive treatment. It can be performed under local anesthesia and causing little discomfort, reducing the surgical time and time stay in the hospital. For recommendations, the use of the laser in the otolaryngology is both interesting and promising, so training of the ENT surgeons on the laser techniques and procedures by attachment with specialized centers and with laser institutes is recommended, and we recommended providing hospital with a new and more advanced laser system. For further studies, long-term follow-up and more patients should be taken, and more objective tests are still necessary to establish the efficacy of the diode laser. Thank you.
Any questions?
And that's Robert. I have a question. I just want to know, in your study, when a patient received a laser therapy, you eliminate the patient psychology problem. I mean, because that I will tell you a story. You know, in China, several doctors were killed by his patients, and we investigate this. Investigate this issue. We found some patient complain there's nasal obstruction in my nasal. But we found actually he is mental disease, not a nasal disease. So in China now we sometimes we should before the patient receive inferior turbinate surgery, we should ask the patient consult a psychology doctor. Whether we just eliminate the patient have a mental disease. I don't know in your country, if the patient you encounter such a patient that's a mental disease.
Well, really, this study we have examined the patient first for anterior anoscopy and endoscopical examinations. Also, we have done CT because we excluded the bone hypertrophy of the inferior turbinate. We only selected the pure turbinate hypertrophy. I excluded septal deviations, previous surgeries, nasal polyposis, and also we depend really on the Cotton test, which they see the patency of the patient say it's obstructing without the normal Cotton test. Does not include this study. We didn't take it.
Okay.
I'm sorry. You said that in your country you actually refer patients for psychological. You say that in your country you refer patients for psychological evaluation?
Yeah.
For complaining from nasal obstruction.
Yeah, I mean, several doctors were killed in China in the past, maybe past 4 or 3 years. We investigate the whole process. We now know some patient complained there's some nasal obstruct. The patient had the symptom of the nasal obstruction.
Yes.
But actually, he's not. Actually, he's the mental disease. If the doctor performs surgery for him, his symptom will become severe. It become more severe. So that's the problem. So I just want to know your country.
That's interesting. I think for me it would be me, the patient, parents, and the lawyer would be discussing matters.
We can do this in U.S., but in Iraq we cannot do this.
No, I was thinking.
Because everyone is living under stress.
No, but that's very interesting.
I take about 50 patients, but actually what I'm follow up is only 14 patients because the road is crossed, nobody can attend. After the patient is feeling satisfied, he'll never visit you. So actually the only remaining 14 patients who I followed them really. But really we take at the beginning 50 patients. So this is what happened.
Does the psychological evaluation lead to positive results?
Yeah.
When they patients do well when you send them. Yeah. That's very interesting, because I never thought about it that way. I'm sorry, go ahead, I apologize.
You would get a call from the insurance company.
Yeah.
Thank you. No problem. It's nice to see this treatment of turbinates have really evolved from very aggressive to much less aggressive.
Yes.
The side effect of doing too much there is much worse than the disease process. Have you had any issues with osteitis, anything like that? Because this is sort of the problem you have with monopolar cautery in that area. It's one of the reasons they've gone to bipolar a lot in the inferior turbinate.
Sorry, I didn't get your question.
When you do your procedure,
yes.
Do you have any inflammation around the bone itself?
No, I didn't have any. Yeah.
Thank you.
But what I found really it's the effectiveness of the laser after now it's since 2013. Some of the patients come to you after 6 months, 8 months. The results, it's the patients are more satisfied when you are using laser. And in this study, I use interstitial. Really, I stopped it now. I'm just using linear, and I'm doing it local. You can do it in your clinic if the patient is, there's no pain. It's discomfort, really. It's not, no pain.
Right. Thank you. We'd like to give you the certificate of recognition for this excellent speech.
Thank you.
And thank you for coming such a long way. Appreciate it.
Thank you.